have some updates since my last brain lesion update video. First, I want to say thank you to everybody who left comments on that video, who's got multiple sclerosis or something in that realm, who gave me advice and suggestions on like how to handle what's going on with my neurologist, what to ask for, yada, yada, yada. It was helpful for me, and I did end up using a lot of your suggestions, and I'm going to talk about that more now. So there were a lot of comments left saying that after they rule out that it's not a tumor or something along those lines, when you're having a lesion that could be demyelination, but they aren't sure because it's white matter, which can be a lot of different things. But the fact that I'm also having MS symptoms means that they definitely should have done an MRI to my spine, not just my brain, as well as possibly an LP, which I had left like some text in the previous video, but a lot of people I don't think saw it, saying like, would you ask your neurologist for an LP? Both because I've suspected intracranial or idiopathic intracranial hypertension, which is diagnosed through a LP if you don't have papilledema, and I can't see my ophthalmologist until October 21st, and during just a dilated eye exam it was inconclusive, so I need an OCT scan to fully rule out papilledema. But also you can use an LP to test the spinal fluid for something called O bands, which 95% of people that have MS have O bands. So it's considered like a not explicit like diagnostic criteria, like you cannot have O bands but still have MS, but generally if you have O bands present in your spinal fluid, it's a sign of having multiple sclerosis. So I sent this email to my neurologist. It was a very long email where I outlined all my symptoms, including, I can't remember what it's called, but when you turn your head down like this and you have the jolt of lightning like down your spine to your feet. She said that she thinks that is nerve pain from my neck stiffness and neck problems, which again, I'm like, yeah, probably nerve pain from multiple sclerosis, but like this is like a known sign of multiple sclerosis. Anyways, I asked for an LP for the reasons that I stated in this video. I also asked for a MRI of my spine, and I phrased it more of like, can you tell me why you didn't like order one that included my spine, because like I could have MS lesions on there if this is an MS lesion. And she said that she will order one for my spine, but she warned me that a lot of the times insurance won't cover it. So that's not ideal or good, obviously. She also said she's going to order one for my lower lumbar region, since a lot of the spasms I'm having are now located in my thighs and my glutes. And these are spasms I'm having pretty much on like a daily basis. Often when I'm like sitting down, not doing anything. I haven't had any numbness in my legs yet, but I have started to have some numbness in my feet that I was, again, writing off as like me sitting on my feet because I'm hypermobile. So like I sit in weird positions and constantly change the positions I'm in because it's uncomfortable for my joints to be in the same position for a prolonged period of time. But anyways, she said she would order those things. So surprisingly helpful, even though again, she thinks that the like lightning bolt down my spine is just nerve pain. I digress. She also said she doesn't schedule LPs, but she forwarded me to people in her office or in a different office that do schedule LPs. So she forwarded my email to them, and they emailed me back saying they would tell the office to like put in the order to schedule an LP for me. So that is something that's coming up. I'm very nervous about it because with being hypermobile, like it's apparently very difficult on our bodies. So I'm hoping that when I schedule it, or maybe I'll email this guy back and ask if I can get a blood patch with it. And then I still need to call the place to schedule the 2 other MRIs that my doctor scheduled for me. Although I've been having this huge issue lately with IU Health when I schedule MRIs, that they schedule me for the stronger magnet, even though I have a shunt in my pulmonary valve that they don't know the materials of. So I'm not allowed to be on the stronger magnet, which leads to them calling me an hour beforehand to cancel these MRIs that I've had scheduled for weeks. So when I'm scheduling this, I'm going to make sure that I ensure that it is on the less strong magnet, because now I've got trauma from having 2 MRIs canceled in the past week for that same reason. But yeah, that's the route that I'm going to go, I think. I haven't heard back from my PCP, who I emailed requesting that she put a referral in to me at IU Health's Multiple Sclerosis Center to a specific doctor who's a woman, because I like to have doctors that are women because I do feel like they listen to me better. And her specialty is in like neuroimmunology, I think is what it's called. So neurology, and where neurology and autoimmune diseases intersect. So I think that will be a pretty good fit for me if I can get referred there. I truly actually think that my neurologist is doing the best she can to get me the things that she thinks she should get me. And she's a nurse practitioner, by the way. I feel like I should clarify that. Because when I've seen her in person, she's always been really wonderful, and she's made me feel listened to. I just think it's not translating well over email, and I think she's just not super knowledgeable when it comes to multiple sclerosis. And so even though I don't dislike her as a person, I still think that seeing a specialist is a good idea so that I can see somebody who does know a lot more about multiple sclerosis and will be able to easier distinguish the difference between the symptoms I'm having that are migraine related versus multiple sclerosis versus potentially hypermobile or connective tissue disorder related. I know I'm complicated. I got a lot going on. So I do need people who are knowledgeable in a lot of the things that I have going on. And it's difficult to find. And to everyone saying multiple sclerosis is something that takes years to diagnose and it's a differential diagnosis. I know all this. I've had migraines since I was 9 years old. I've been seeing neurologists since I was 9 years old. I've seen so many different neurologists. The symptoms that I'm having that are related to my multiple sclerosis emerged about a year ago, which I first brought up to my neurologist about a year ago. And that's when we started doing, that's when she first suggested Botox injections. It took me about 5 or 6 months to decide if I wanted to do it. And that's also when she suggested that she thought I had hypermobile Ehlers-Danlos syndrome. So maybe that's why I'm attached to her, because I feel like that's the first doctor that's ever brought that up to me. I had already heard about it, but the first doctor that had suggested it, and she gave me the suggestion for my primary care physician to refer me to in genetics, which I have gotten a referral for, but it's a 3-year long wait list. Yeah. Anyways, all that to say, I'm well aware it can take a long time. And I don't know if people are saying that to comfort me, but I don't find it comforting. If anything, it's really frustrating, because multiple sclerosis, if that's what this is a progressive disease. And so treatment is kind of you want it sooner rather than later, so that it doesn't have time to progress to the later stages of it. And so it is important to get treatment sooner rather than later. And even though it's normal to take longer to get a diagnosis, I don't like the fact that people are trying to normalize it in my comments as I should be happy that anyone's listening to me, I guess, because it shouldn't be this way for anybody, in my opinion. But yeah, that's the update. I'll let you know more when I know more. Hopefully my insurance covers the MRI of my spine, and my PCP refers me to that other MS specialist neurologist, and things get moving faster. I mean, I guess compared to other people, they're moving faster than some people experience, but at least so I can get some treatment, even if it's just for the nerve pain and the numbness, even if it's not addressing the full scope of the multiple sclerosis possibility.